Hi, this is Abdulhamid Ramani, an emergency medical technician currently in Nkari Ambulance Station. Please kindly subscribe to my YouTube channel Bansi TV for more EMS short videos. Today I would like to discuss with you about the speed rapid trauma assessment of a trauma victim, how to conduct a rapid trauma assessment of an unconscious trauma victim. Now one will ask, what is rapid trauma assessment? It's an assessment normally done by EMS personnel, which is done to identify any hidden and obvious condition or critical condition of a trauma victim. Now, for a rapid trauma assessment, it's supposed to last for about 60 to 90 seconds. So it has to be very fast. But we are doing that to identify any life-threatening condition of a trauma victim. Now, we do that rapid trauma assessment using the mnemonic DCAP-BTLS. And the DCAP-BTLS is an acronym or mnemonic which we use to identify any soft tissue injuries of a trauma victim. Now, the DCAP-BTLS, D stands for deformities and discoloration, C for contusions, A for abrasions, P for punctures or penetrations, B for burns, T for tenderness, L for laceration, and then S for swelling. Now, it's a kind of head to toe to posterior assessment of a trauma victim. And like I said earlier, you have to be very, very fast. So before you begin with your rapid trauma assessment, first make sure you have your body substance isolation with you, so which we normally call the BSI precaution. So depending on the case at hand, you need to have your gloves, your eye goggles, your helmet, depending on the case you are responding to. You need to also make sure the scene is safe before you get closer to the patient, because safety is very, very paramount. And like I said, I always say, safety first. Now, you also conduct your rapid assessment immediately after you finish with your initial assessment. So you begin with the head, but before, make sure your other partner or your second rescuer is providing stabilization of the head and neck in the inline position manually. So you start with the head using the acronym DCAP-BTLS with your gloved hand, looking for any evidence of bleeding. If there is any major bleeding, make sure you control that bleeding before you move to the next body parts. When you get to the neck, you still with the DCAP-BTLS, you look for any trachea deviation. Looking for, with the trachea deviation, when you realize that the trachea has moved to either the right or the left, then it's an indication that, assuming it has moved to the right, then that means it tells you the left lung has collapsed. So that means the patient is having a tension pneumothorax, which you are supposed to provide quickly. You need to do a needle chest decompression, which I'll come to that in my next video. Still on the neck, after you check for trachea deviation, you're also looking for any jugular vein distension. After you check for all those, quickly apply a rigid size cervical collar. After you apply the rigid size cervical collar, still let or allow your partner maintain the head and neck in the inline neutral position. Moving to the thorax, still the DCAP-BTLS. Check for any crepitus, flayed chest, open chest wound, which we call the sucking chest wound, and make sure you manage any critical condition you find over there. Then move to the abdomen, still with the DCAP-BTLS. You are looking for any distension of the abdomen, you are looking for any pulsating masses, you are looking for any sign of evisceration, and you manage it when you find those conditions. You move to the pelvic. With the pelvic, still with the DCAP-BTLS, you need to also check for any paradoxical movement of the pelvic, which is an indication of a pelvic fracture. Then the moment you identify a pelvic fracture, you need to quickly stabilize that pelvic region. Also look for any sign of priapism for male victim. Then you assess the upper and lower extremities using the acronym DCAP-BTLS. When you are done with the upper and lower extremities, you log roll your victim either to the left side or to the right side, and then you assess the posterior, meaning the back of the victim, still with the DCAP-BTLS, looking for any rectal bleeding from the victim. Then you log roll the patient back at this time onto a spine board, and then you continue with the mobilization of the victim. Thank you once again. Please kindly subscribe to my YouTube channel, Vancy TV, for more ENT short videos.